And I can announce our next and final speaker for today, who is Dr. Amrutha Allalath, a distinguished Ayurvedic physician and healthcare professional from India. She holds a postgraduate degree in general medicine, particularly in Kaya Chikitsa, from the Government Ayurveda Medical College in the city of Mysuru. She is certified in yoga therapy and basic life support as well. Her professional experience spanned patient-centered care, clinical research, and wellness promotion, including work as a resident medical officer and a volunteer during the COVID-19 pandemic. Before we conclude the day, let me welcome Dr. Amrutha Allalath, our final speaker of the day. Good afternoon.
Good afternoon. Thank you so much for your introduction about me. Thank you. Good afternoon. Um, my name is Dr. Amrutha Allalath, and I would like to present on the topic an open label clinical trial to evaluate the efficacy of Matra Basti with Sukumara Ghrita, followed by administration of Vaishwanara Churna in the management of Vibandha, vis-à-vis constipation in geriatric age group. So, as we know that constipation in geriatrics is $1 million business, and I was also interested in managing geriatric patients of mine. This study was completely aimed at their gut health and constipation management in the age group of geriatrics. So, this will be the contents that I will be going through this presentation about introduction. As we know that most of the nations are undergoing rapid and dramatic aging, and by 2050, we are expecting that 25% of the population will be older than 65. And even though aging is a unique natural biological process in every of a species, we know that they are most vulnerable population to diseases. And among the geriatric age, the constipation is a frequently reported bowel symptom, and economic burden and adverse implications on quality of life and health state in geriatric age group make constipation a major public health issue. And we got like two causes of chronic constipation among geriatrics. Their primary and secondary causes. As I have tried to avoid secondary causes of constipation in my study, because like secondary constipation is mainly caused by the medications and obstruction, metabolic disorders like hypothyroidism, neurological disorders, systemic disorders, and psychiatric causes. So I was mainly focusing on primary causes in my study. They're being classified as normal transit constipation, slow transit constipation, and the one which is including evacuation disorders. So, evacuation disorders will be having a group of function as well as anatomical abnormalities. They will be having poor toileting habits, obstetric, and history of lower back injuries as well. So, in the current scenario, drugs such as the bulk forming agents, stimulants, and stool softeners, osmotic agents, secretagogues are mainly commonly used in the modern era of medicine. And even though the conventional treatment is well established and safe, and it doesn't provide that correct improvement for the geriatric age group, in Ayurveda, we can see the terms like Vibandha, Malagraha, Malabhaddada, that which are the correlated terms with constipation. So this is what the Ayurvedic understanding of constipation is. We have different terms like apanavata as well as the gunas like rukshata. So in basically what happens in geriatrics is that the qualities like rukshata will be increases. That means like they have dryness in even in their gut health system as well as, so that is causing obstruction and dryness of their fecus, and even the obstruction that is leading to constipation. So that is a term Vibandha, what it is meaning of. So this effort was made to study in detail about the causes, etiopathogenesis, and management of constipation with a clinical study titled and single-arm clinical trial to evaluate the efficacy of Matra Basti with Sukumara Ghrita, followed by administration of Vaishwanara Churna in the management of Vibandha. That is nothing but geriatric constipation. So we have taken the medicines which is like specific helpful in management of the constipation, that is helping in the evacuation of fetus and flacus through Sukumara Ghrita, that is was given in the form of an enema. And after that we have administered a medicament which is having the properties of combination, as well as which can help in constipation and easy movement of flatus as well. So, from the study, it can be concluded the intervention of Matra Basti with Sukumaragata, followed by internal administration of Vaishwanara Churna, was found to be as effective in geriatric constipation. So, objective of the study is it was to evaluate the efficacy, as I stated. So, the materials and methods include the main materials that we taken for the study was Sukumaragata for the enema and Vaishwanara Churna as an internal medicament. So, Sukumara Grita was given to the patients in the form of Matra Basti. That is nothing but a kind of enema in the smaller dosage. In the dose of 60 ml, we have administered to the patient. And Vaishwanara Churna, it was given in the dosage of 12 grams before food in divided doses for 22 days after the course of Matra Basti. So it was an open labeled clinical trial research design, and the subjects were assigned to a single group, and we have administered the Matra Basti followed by internal administration of that medicament, and the results were analyzed statistically. We have the subjects from OPD and IPD of Government Ayurveda Medical College Hospital, Mysuru, Government High Tech Panchakarma Hospital, Mysuru, and other referral sources who were diagnosed with Vibandha vis-à-vis geriatric constipation. Out of the 38 patients registered, 32 completed the study. The duration of the study was 30 days. And for diagnostic criteria, we have taken Rome for diagnostic criteria. So for to diagnose, especially the functional constipation, at least two from the Rome for diagnostic criteria, and with a duration of 3 to 6 months was needed. So this is Rome 4 diagnostic criteria, and it has scored five of this criteria. Among the five criteria, at least two has to get filled, and the subjects should have a history of 3 to 6 months. All the subjects of belonging to 60 to 75 years of age group, irrespective of gender, caste, and religion, were included, and the patients with the stool form scale, one or two on the Bristol stool form scale, were included, and the patients meeting Rome for diagnostic criteria for functional constipation were also included. And we tried to exclude the subjects on medication that is supposed to cause secondary constipations like opioids, anticonvulsants, and tricyclic depressants. And we have excluded the subjects with structural gastrointestinal disorders like the colorectal carcinoma, diverticulosis, stricture, internal hemorrhoids, rectal prolapse, etc., and subjects with blood pressure levels above the range of 150 by 100, as like medicaments also can causes the constipation. So I try to avoid the disease as well as the medicaments causing the constipation. And subjects of uncontrolled diabetes with random blood sugar level above 250. And the assessment schedule was using the Bristol stool form scale. We have mainly taken two kinds of parameters for understanding, for assessing the geriatric constipation, like the treatment, how it was affecting or how it was useful for the geriatric population. So the two assessment criteria that we have taken was one was Bristol stool form scale, and other was PACQL. It means that patient assessment of constipation quality of life. So it's a quality of life understanding. So the Bristol stool form scale was done on 0 day, 9 day after the enema, and 22 days after, even after the medicament administration. So this is Bristol stool form scale. We can see like type 1 to type 7 grades of um, stool formations, the characteristics of stools. So the type 1 and 2 were considered, as I told, in the diagnostic criteria. So this was the criteria that I used for the assessment as well. And for the patient assessment of constipation, it was done three times during the study, on the 0 day, on 9 day after the enema, and after the completion of intervention. It was like 28 questions were there in the study, and the whole data was collected on 0 day, 9 day, and one first month, like the completion of the study, and the data were analyzed statistically by applying the following statistical methods. So, like we have taken descriptive statistics as normal, like mean, standard deviation, frequency, percentile, and inferential statistics. We taken t-test pair, t-test pair test, and chi-square test, Wilcoxon sign test, and all the statistical method were done using SPSS for Windows. So, coming to the intervention, as I said, Matra Basti with Sukumara Krita, it means enema with Sukumara Krita, was given for the first 8 consecutive days of intervention in the dosage of 60 ml. So we have like particular procedure for enema. So this enema was that the special title of the enema itself suggests that it is indicated for sukumaras. That means that people who are not tolerant to the heavy administration of medicines or heavy therapeutical procedures. So it was the safest method for geriatrics as well. So it was given in the dosage of 60 ml, and afterwards we have given Vaishwanara Churna with Ghrita as Anupana. Anupana means we tried to suggest the patients to mix Vaishwanara Churna along with some ghee as an Anupana, as an like substituent, means along with that medicament. And it was internally administered in two equally divided doses before food for 22 days. And the total duration of the study was 30 days. So the observations were made on 15 characters, so mainly age, gender, religion, status, locality, nature of current occupation, history of emotional stress, that I would like to include all the observation details in my conclusion as well. So we try to include the digestive power based upon the Ayurvedic parameters, the number of vegas or the number of times the people were doing defecation, and the type of the foods they were consuming, and any history of they have suppressed their urges for defecation, and Bristol stool form scale, and PACQL scale as well. So coming to the results, like as I told, two parameters were mainly used, and that was during 3 times of the study on zero day, 9 day, as well as the completion of the intervention. So, and coming to Bristol stool form scale, before treatment, 28 subjects had grade 1 and 6.3 percentage had grade 2, and two subjects with 6.3 percentage in the grade next level on the 0 day of assessment. And mid treatment, out of 32 subjects, 15 subjects had grade 5, 11 subjects had grade 4, and only one subject had grade 2 in Bristol stool form scale. And out of 32 subjects, 16 subjects, that is 50% of subjects had grade 5. That means a kind of an improvement that you can see that I would like to discuss in the conclusion part. So the result obtained regarding this score of Bristol stool form scale showed statistically significant. That means that there were statistically significant results when we are comparing with before and the mid treatment, and as well as the before and after treatment. That means that Matra Basti has a significant role that I would like to discuss in the conclusion part, as well as the intern administration of medicaments. So the whole procedure was found effective. So results from the Friedman test, it is evident that there was significant improvement in score of the stool form scale on overall all assessment, with a chi-square value of 53.034 with a p-value of 0.001. In patient assessment of constipation, the t-test overall decrease of standard deviation of 11.901 in before treatment to 5.930 in after treatment is noted, showing overall significant improvement in quality of life of the subjects with constipation. So, coming to the discussion part on the Vaishwanara Churna that we have taken as a medicament, the ingredients of Vaishwanara Churna was Trachispermum ame, Gingiber officinal, and we had rock salt in that main medicament, and Terminalia chibula. So all these drugs in combination were supposed to have Tridosha Shamaga property. That means that it helps in controlling, pacifying the overvitiated doshas. And but this specific churna, it is mainly aiming at improving the cognitive actions of the digestive capacity, the metabolism of the patient, and that could help in easy evacuation of the fetus and flacus. And coming to discussion on Sukumara Ghrita, it's a Sukumara Ghrita. Ghrita means a ghee, actually, but it is an example of Yamaga preparation in Ayurveda. So Yamaga preparation means there will be like two constituents, like it will be having ghee and an oil. So we had castor oil in that. So being a Yamaga preparation, it was considered as more Brahmana. Brahmana means it is more nourishing that could help also in the geriatric age group. And all the drugs in all together, that was vada pitta hara. It had carminative actions. It was nourishing action also was seen. And the gunas like the unctuousness, the hot potency, and the property of easy evacuation of flatus and fecus, as well as the nourishment capacity of that whole drug was used in geriatric constipation. Coming to Matra Basti, in Ayurveda, Basti therapy is one among one. It's not one among. It's a prime among all therapeutic measurements, especially for Vata Vyadhi, any diseases caused by the vitiation of Vata. So, and coming to Vasti, it is specific at there are like five kinds of Vata. So, in that five kinds of Vata, Apana Vata is the one that is mainly we are focusing in geriatric constipation. So, Basti is one of the main medicament or main kind of therapeutic measures that could help in helping in easy evacuation of Apana Vata or easy functioning of Apana Vata. So it helps in early voiding of the stool. So this type of basti is indicated especially in Bala and Vridha. That means in pediatrics as well as for the geriatric age group. So it helps in retention, relieving the retention of urine, stool, and flatus, and it is administered through the rectal route. It reaches the Pakvashya level, that is the main point of the site of the Vata dosha. And so, as the Vada is specified, disease itself get cured because it's major causative factor in the disease. So, in the present study, Sukumaragita was used for Matra Basti, and as I discussed before, it was having all the properties that is mainly aiming at geriatrics, helping in improving their digestion, improving their nourishment, and easily evacuation of the fetus and flacus in flatus. Coming to discussion on results, overall assessment of Bristol stool form scale. In pre-test assessment, 28 subjects were in grade 2 and 2 subjects in grade 3 and grade 4. And in mid-assessment, 1 subject was in grade 1, 5 subjects in grade 4, 11 subjects in grade 5, and 15 in grade 6. In post-test assessment, 4 subjects were in grade 4, 12 subjects were in grade 5, and 16 subjects in grade 6. There was highly significant improvement of score of grade 1 in 87.5% of subjects to grade 6 in 50% of subjects and grade 5 in 37.5% of subjects after the treatment. The pre-test and post-test results of the parameters Bristol stool form scale has shown high significant results with a p-value of less than 0.001. It can be interpreted that the stool consistency showed significant results in the Bristol stool form scale after 30 days of intervention consisting of Matra Basti with Sukumara Ghrita for 8 days followed by internal administration of Vaishwanara Churna for 22 days, and there was even significant improvement in Bristol stool form grading even after 8 days of Matra Basti. While comparing the results between 30 days of whole treatment and after 8 days of Matra Basti, it showed insignificant result. That means that either as a Matra Basti, it was found to be effective, and even with the whole procedure, including the internal administration of medicament and enema, was found effective. So there was no significant results in between when we are comparing the effects of both of them. So the whole process of Matra Basti in the form of Mritu Shodhana, Agni Deepana, and Vatan Lomana might have helped in quick retrieval of symptoms. There is obstruction of fecus. That would be the reason there was significant improvement after 8 days of Matra Basti. Internal administration of Vaishwanara Churna with properties of Vata and Lomana, Agni Deepana, Vibandha also helped in relieving constipation in addition with Matra Basti. The significant improvement while comparing the Bristol stool form scale before and after treatment support the data. Coming to discussion on PACQL, that is the quality of life assessment scale for the constipation. The main score was at baseline on the time of the baseline visit was 73.91, and it decreased significantly to 35.94. It shows that there was significant improvement in quality of old age subjects on 9th day and on 31st day after the whole study, and the result shows there was significant improvement in quality of life after the study. Coming to conclusion of my study, chronic constipation is a common disorder in elderly population globally and is associated with comorbidities and negative implications on quality of life. Ayurveda, the science of life, has considered Jara or geriatrics. The name itself is like they are quite similar, Jara and geriatrics, and Ayurveda has considered Jara under the umbrella term of Swabhava Bala Pravritta Roga, that is caused in naturally it will happen. So the age we cannot try to stop them. So it occurs, it happens by on time. So although constipation is a physiological consequence of normal aging, decreased mobility, medications, underlying diseases, and rectal sensory motor dysfunction also contribute to increased prevalence in older adults and is characterized by infrequent bowel movements, results in passage of small amounts of hard and dry stool. This is brought about by numerous causative factors such as dietary, mental, as well as lifestyle factors. Even though there is direct and explicit description of constipation as a disease is not found in Ayurveda, but there are like different presentations of purisha or the stool, like constipated stools or hard stools, or we can see the dry stools or the obstipation or like the complete obstruction to the passage of fetus and flacus are found in different contexts of Ayurveda. Non-compliance of healthy diet, healthy lifestyle, and mental stress and strain are responsible for this disease. Study on etiopathogenesis of Vibandha clearly indicates a predominance of apanavada vritti and agni mandita, that is reduction in their metabolism and increased functioning of vada. The treatment modalities to specify Vipanda includes Nidana Parivarchana. That means that um, trying to avoid the food and dietary habits and even the lifestyles that can causes the increased occurrence of constipation, oleation, sedation, internal administration of drugs with properties of easy evacuation of fetus and carminative actions, usage of suppository, Niruha Basti, Anubhasana Basti, as well as Virechana. In the present study, an attempt was made to validate the efficacy of Matra Basti with Sukumara Ghrita, followed by internal administration of Shamanaushadhi named Vaishwanara Churna. The qualities like Vadanilomana, Deepana Rasayana Sukumarakrita in the form of Matra Basti. So basically, this Basti and medicament was really good at improving the digestion of the geriatric population and for the easy passage of that fecus and flatus, and for the anti-constipative actions. So both of these drugs were used in the clinical trial. The study was an open label single group clinical trial which was conducted on 32 subjects. Among 32 subjects, maximum number of subjects were male, and the incidence of geriatric constipation was seen among other subjects who were belonging to the lower class and urban area. Geriatric constipation was more among the subjects who were used to take foods that it's rich in the qualities like which is light, which is very dry, and they were like predominantly having hot and spicy food as well, and they had history of untimely taking of food and not proper having sleeping, not proper getting the sleep, as well as the history of like suppression of the urges for defecation. History of emotional stress, previous occupation involving long distance walking, traveling and sitting at same place for a long time, working under sunlight without availability of water was also elicited among subjects. It was observed that there was increased prevalence of usage of they were like because the study was done in southern part of India. those subjects were mostly involved in taking the millets and the non-vegetarian food items, that the preparation of that using the millets things as well as the cotyledons, they were not using the unjust part. That means they were not using oil. It was given all as a like dried version of it. So that would be a reason for their constipation, and they were like more prior to take hot and spicy foods, and especially non-vegetarian things that is like quite specific, that may increase the excessive dryness of the fecus, leading to constipation. So recommendation for further study. This study can be done in a larger sample size. Total duration of intervention can be extended. And efficacy of Matra, Basti and Shamanaushari with Vaishwanara Churna, it can be given in different groups. So this study was a single group open label study. So it can be done in two groups to understand how these are working different. And gut microbiome can also be assessed in future studies regarding how the medicine works, or how the therapeutic administration works. So these are my references. So thank you for listening. Thanks a lot. Any questions?
Dear doctor, your presentation was really detailed, so there are not any questions needed to be, as you shared really detailed results of the studies. We thank you for joining our event here in Prague, and we wish you a nice day to India. Thank you and goodbye.
Thank you so much.
Thank you.
Bye. Thanks so much.